هذا دكتور أحمد نبدأ.
نبدأ
دكتورة
بعد
فرح.
دقيقة واحدة. نبدأ بعد دقيقة واحدة من الآن، يعني كذا وقت تجهز يعني. دقيقة وبدأنا إن شاء الله.
دكتورة
تمام.
فرح shall we start؟ دكتورة فرح. Okay.
Yes, sir.
Okay.
In one minute we should start. Okay, 1 minute.
Okay.
Okay, دكتور عمر.
Okay, I will start دكتور أحمد. Okay.
Okay.
بسم الله الرحمن الرحيم. بسم الله الرحمن الرحيم. Welcome everybody for our lecture in the program, in the comprehensive neuroanatomy educational program that's held by Yemeni Neurosurgical Society with the Association of the Pakistani Neurosurgical Society. Today we have Dr. Farah Angam from the Bumbar Clinical that we presented for us 9th and 10th cranial nerve anatomy and applied anatomy. Please listening to him, and if there is any question, let him to the end, please. Dr. Farah, it's for you now.
Thank you very much. First of all, I thank you, the Yemeni Neurosurgical Society, and also Dr. Fanes to organize the workshop. And it's very helpful for all the students and all the neurosurgical residents. So thank you very much to give me the chance. I will now share my screen. Is it visible to everyone?
Yes, perfect.
Thank you very much. So today's workshop, I break it into two parts. So first I will just give a quick introduction of that my lecture. It will be cover the glossopharyngeal nerve, it's the 9th cranial nerve, and the second part will be the 10th cranial nerve, which is vagus nerve. So this figure, I find it very interesting because this explains all the nerves and also what is the origin and which foramen it crosses, which is very important for the anatomical orientation. So the glossopharyngeal nerve actually it's carrying sensory, motor, and parasympathetic innervation. And it's also give a sensory innervation to the visceral, and also there is a somatic sensitivity.
Dr. Farah, if you can please make the mic closer to your mouth so the noise will be less.
Yes, sir. Yes, thank
Okay,
you,
thank
sir.
you.
So the glossopharyngeal nerve is actually a means which carry the sensory motor and the parasympathetic fiber, and which origin from the medulla oblongata, and it's leave the brain to the jugular fluid. So I said the anatomy that it originates from the medulla oblongata, and it's distal to the jugular fluid, and has two sensory ganglia. One is superior, one is inferior, which also located near to the jugular foramen. And motor fiber innervates the stylopharyngeus muscle and parasympathetic fiber is innervated to the parotid gland via the otic ganglion. It's just image presentation how it is coming from the midbrain, and if we follow the green line, then you can see that it is the violet part is representing the test and the visceral sensory part, and the red is representing the motor, which is of the stylopharyngeus muscle. Another image, just to make more correlation with the anatomy. As I say, the nerve is originate from the medulla oblongata, and it's having the superior and the inferior ganglion, and it's supply the otic ganglion and also the parotid gland and carotid sinus, carotid body, and in the tongue, it's named as a lingual branch. It is an image just to correlate the anatomical pathway, that it is coming from the medulla oblongata, and then it crosses the jugular foramen, and it's come out from the brain and innervate to the tongue and the stylopharyngeus muscle. So just how I say that it is coming from the medulla oblongata, and it's the same movement as the jugular foramen. It's coming the vagus and the glossopharyngeal. And today now my topic is around the glossopharyngeal nerve. So the pathway is the tympanic nerve, which enters the medial ear cavity and supply the tympanic plexus, and lesser petrossus nerve, which is parasympathetic fiber, and with synapse at the otic ganglia. And carotid sinus nerve carries the sensory information from the baroreceptor and the chemoreceptor. And the lingual branch provide the taste and the general sensory to the posterior third of the tongue. And tonsillar and parapharyngeal branch are the sensory innervation by the pharynx and the tonsil. So this is how I just explained that what are the nerve and what are the branches. It is just an image again, because anatomy is all about the image and the orientation. So I just use a lot image just to have a clear idea about the nerve. This is very important image. I find it out that the relation where is the glossopharyngeal nerve, and the green one is the stylopharyngeus muscle, and it's very close to the common and internal carotid artery. So what is the importance? Why we are learning the origin and the pathway and the anatomical relation? Because it is carrying this nerve innervate our gag reflex, and it causes the severe ear pain, and damage of the nerve can lead us to loss of taste, sensation in the posterior third of the tongue, and impair the swallowing. And it also can be damaged during the carotid artery surgery, or it can be caused when we are surgerying the carotid artery. It can also create the compression of the nerve. And due to dysfunction, it can also affect the cardiovascular and the respiratory reflex via the carotid body and the sinus innervation. This is a complex image, but I find it very interesting because at a glimpse, one can see that why it is important, that it is actually very close to the, not only very close to the internal carotid artery, but it's also giving the sinus, the sensory innervation to the nerve, and also the tongue, posterior third, and also the stylopharyngeus muscle, which is helping for gag reflex, taste sensation, and also the cardiovascular like it can compress by damaging the nerve, it can also damage the innervation of the artery. So this is my reference, what I use to make this slide. I will now present my second slide, which is about the vagus nerve. Is my screen is visible to everyone?
Yes, it's good.
Yeah, thank you very much. So the 10th nerve is the vagus nerve. So why actually it's named vagus? Because it is actually a very vast distribution. It is the 10th nerve and it is having a multiple functions, which is somatic sensory, visceral sensory, spatial sensory, somatic motor, and visceral motor.
It's 45 minutes.
So the vagus is the 10th cranial nerve, which carries the motor, sensory, and the parasympathetic fiber. And just because of having a wide range of the body structure, this nerve, the Latin word, it comes from the vagus, which means wandering. So it's had an extensive distribution from the brainstem to abdomen. So what is the pathway? The pathway is it originates from the medulla and emerging as multiple rootlets between the olive and inferior cerebral peduncle, and it leaves the skull through the jugular foramen and has two sensory ganglia. One is superior ganglion, which is very close to the jugular foramen, and another one is the inferior ganglion, which is located just below to the jugular foramen. If we now look the image, so as we now oriented that this is our midbrain and the vagus is mid, and it's at the cross distribution. That means innervation is to the heart, innervation to the lung, innervation to the kidney, liver, and spine. So it is also very interesting image which represents the importance of the vagus nerve, because here we can see the nerve is coming out of the medulla oblongata and it's actually innervating the heart, and also there is a branch is coming out which is superior larynx, which is very important for our deglutition of swallow, and also branch to the trachea, branch to the esophagus, and also lung, heart, and other abdominal organs, including liver, kidney, and also intestine. So, this vagus nerve is having nucleus and mass. Nucleus, dorsal, yes. Nucleus, rectus solitarius, and spinal trigeminal nucleus. So, nucleus ambiguous is a branchial motor fiber which innervate the larynx, pharynx, and the soft gland, which is responsible for the swallowing and the phonation. Dorsal nucleus is the parasympathetic fiber. So parasympathetic means that it is like visceral innervation, that means heart, lung, GI tract, abdominal different viscera, and nucleus tractus solitarius is the visceral sensory which receive apparent input from the thoracic and the abdominal organs. And most importantly here is the baroreceptor and the chemoreceptor. That's why vagus nerve is very important for us. And spinal trigeminal nucleus is the somatic sensory, which carries the fiber from the external air, meninges, and posterior cranial fiber. What is the course? So it is having courses intracranial, and when it leaves the cranium, it enters the thoracic part, and then it, when it leaves the thoracic part, it enters to the abdominal. So intracranial force is originating from the medulla, passes posterior to cranial process, and exits through jugular foramen. In the neck, it lies close to the carotid sheath between the internal jugular vein and common carotid artery. This relation is very important. And the thoracic force gives rise to the cardiac, pulmonary, esophageal branches. And here it divided into right vagus and the left vagus. The right vagus passes posterior to the right bronchi and forming the basal shunt. And left vagus cross the anterior to the aortic arch, then form the anterior pedal shunt. And the abdominal force by the name we can correlate that innervates the abdominal organ, such as stomach, intestine, part of large intestine, transverse colon. So just what I explained, it is innate, and I find it also this memorize that which part of the nerve is actually innervating which part. Very interesting of anatomy is whenever we know the name, like laryngeal branch, in the exam we can say, okay, it innervates the larynx. So cardiac branch is to the heart, esophageal, and esophageal branch make the esophageal plexus, and celiac branch is supplying to the abdominal organ. Here I also find that it is also very interesting to present that what are the and there is this line. Before I also share this picture, but I find it very important that it is sensory and chemosensory, which is actually chemosensory is only for the test part of the epiglottis, which is in the posterior part, and the viscerosensory is the larynx, thoracic, and abdominal viscera. And as we already know, the motor part is on the larynx palate, which is helping us for swallowing. And parasympathetic is the autonomic ganglia of the thorax, abdominal organ. And somatosensory is the outer air canal, pinna, and the dura. So what are the functions? Motoric function is the muscle of the soft palate, pharynx and the larynx, shelter for the speech and swallowing. The sensory is the sensation, thoracic and the abdominal viscera. Test from the epiglottis and sensory from the air. And parasympathetic is the when parasympathetic is innervate, that reflect us as a decrease of heart rate and stimulate the digestive process and control the glandular secretion. So the vagus nerve is 80% is afferent. That means it is sensory. And 20% is efferent. That means it is motor. Why actually we are learning, discussing about the vagus nerve, what are the importance? So when the vagus nerve get damaged, as it supplies the medicine, which is responsible for developing and make the pronunciation or making the voice. So one can correlate the damage to the vagus nerve of horse and due to the recurrent laryngeal nerve. So during the tonsillectomy or during the thyroidectomy, this nerve is very important to dissect and to recognize. It also causes dysphagia and loss of gas reflex, tachycardia due to loss of parasympathetic input, and digestive issues such as gastroparesis or constipation due to innervation of the intestine, and bradycardia or symptom with exaggerated level pain. There are some clinical features which also represent that it is the damage of the vagus nerve is happening. So there are some symptoms and there are some symptoms which represent that the vagus nerve is involved. One of them is Wellenberg syndrome. It is infarction of the lateral midgut, which affects the vagus nuclei and causes the release of gases. There is also vagal syndrome, which is overactivation of the vagal causing sudden vagal and cervical instability, which is can cause the vagal conduction and lead to GLC and altered vagus. It is in epilepsy, brain, and balance. Has also found promise via the cholinergic anti-inflammatory. So that as vagus nerve is very vast, if just want to take away from this presentation, so this is my takeaway. I want to give in 3 points that it arises from the medullary nuclei and it travels from the brainstem to abdomen, innervate, autonomic, across major organs. And patient can affect the vital reflexes, heart rhythm, voice, digestion, and vagus nerve stimulation is a rapid of neuropsychiatry and cardiovascular therapy. This is my reference, and thank you very much to hear from me.
Thank you, Dr. Farah.
Thank you, Dr. Farah. Thank you, Dr. Ahmed. Please, if there is any question from any one of our residents, please send it on the chat and we will give it for Dr. Farah, please.
And we apologize for the noise in the background. Dr. Farah, she's in the airport. So she has a flight after less than 1 hour. So in airport, you know, it's difficult to find a quiet place. And for that, we thank her for joining us, although that she has a flight. And inshallah, next week she also has
God
one
for a nice
presentation
flight
with
for
us.
her, please.
Yes,
Next
inshallah.
week, I ensure
Nice
a
and
very
safe.
silent, calm, and quiet presentation.
Inshallah.
Thank you. So next
Thank you
week
very
she
much,
will
Dr.
make
Farah.
up for everyone, inshallah.
Inshallah.
If anyone have any questions, please, you can ask in chat or raise hand and ask directly if you want. We don't want to extend the presentation a lot, so Dr. Farah can catch up with her flight.
Yes, but if there is any question, I'm ready to answer. If I can't answer, even my seniors are also here to answer you, so don't afraid. Just ask the question.
Okay. So, Dr. Anwar, do you have any comment or any remarks regarding the presentation?
Very nice
or
presentation.
If you want to add anything?
Very, very nice presentation from Dr. Farah.
Thank you very much, sir. Thank you.
She's so busy now, and in airport she cannot thinking a lot. It's very nice presentation for cranial, for the glossopharyngeal and vagus nerve. But if they can to give us idea, if there is any idea about the vagus nerve stimulator, are there is any anatomical approach or anything? Can you tell us about this?
Yes, sir. Vagus nerve stimulation, we also use just press the vagus area, or during the operation, when we need, we can also ask to the anesthesiology for the help. That when we are operating on the brain and we need a hypotension just to decrease the blood so that operative field is clear, then we can also ask our anesthesiology colleagues, and they give a vagal stimulation, which just help us to decrease the blood flow. This is the most practical, and I think I saw that very often.
Thank you.
Also, I think Dr. Anwar, he is asking about vagal nerve stimulation for epilepsy cases, that in case of refractory epilepsy and the depression, asking about indications and approaches, I think. for
Yes,
that.
yes, exactly.
Yes. Do you have any? Dr. Farah is just a resident in neurosurgery. I don't think maybe if she has information about that. Dr. Farah, do you have any information about
Or
approach
see
of
any cases, tell
mechanical
us about it.
stimulation for refractory epilepsy?
Sir, I never saw that practically, but I will educate myself and I can answer that next time.
So that make all of us
Definitely.
the same. We all
Epilepsy and
don't see this.
depression. Yes, sir.
Yes. Okay. Thank you.
Thank you. Thank you very much, Dr. Farah.
Thank you very much, sir, to give me the chance. Thank you.
Okay.
It's my pleasure.
We ask Allah to give you a nice trip, inshallah.
Thank you very much,
Safe,
sir.
inshallah.
Thank you very much.
So I
Thank
think
you,
by
Dr.
this
Ahmad.
Dr. Amar, what do you think? There is no questions. Can we conclude this
No
session?
question. Yes, yes, yes. There is no question. I see the chat. There is no question. Yeah.
Okay. So by this we can conclude our 16th session, and we see you all inshallah next week with the final session of webinar, the module 3 of comprehensive neuroanatomy educational course. And next week we will also have Dr. Farah Anjam. She will has a presentation about accessory nerve and hypoglossal nerve anatomy. And also we have a neuroradiologist who will talk about advanced anatomic MRI imaging for brainstem and cranial nerves. So next week, inshallah, we see you all. And thank you, Dr. Farah, and thank you, Dr. Anwar, for your participation
Thank you
today.
very much. Thank you, everyone.
Bye-bye.
Thank you, and see you all, inshallah, next week.
Thank
Thank you.